Hello, everybody, and thank you so very much for joining us for another one of our amazing seminars. Today, we have the incredible and the very impressive Dr. John Nichols, who is a dentist with the most amazing experience. Look him up online. Dr. Nichols is also just a lovely guy to work with, and he writes an outstanding report. He also does medical negligence matters for us, and what he doesn't know about dentistry isn't really worth knowing about. This man is so impressive. This talk is absolutely sold out. We've sold 200 tickets, so you are in privileged company, because I've had a lot of people saying, please, can I get a ticket? Now, can I ask you all to please keep yourself on mute throughout the presentation so that noise from your home or workplace doesn't disrupt the recording of the session. At the end of the session, there will be time to ask some questions, and you can then unmute yourself at that time to do so. You can also put questions up in the chat function. Pardon me. I'm just keeping to mute everybody. There you go. Put your questions in the chat function. The recording for the session will get sent out to you within a day or so from the session, and you can always watch our sessions on our YouTube channel. Now, I will again share the screen so we can look at that presentation. Here we go. All right, everybody.
Michelle, I've got a notice in the middle of my screen.
Yeah.
This meeting is being recorded by the host or a participant.
Yes, that's correct. That's me.
I think you've got to click on get it to get it off. It's right in the middle of my slides.
Is it right in the middle of your screen?
Yeah.
Has anyone else got that message?
Yeah, you just have to click got it on your own computer.
Okay. I'm going to have to go back sharing because.
All right, I've done it and I've got it off my screen.
Okay. Is it off everyone else's?
Now I'm back to you.
Yeah, I haven't. Okay, I'm going to have to try this a different way. Sorry about that. I can't seem to. Sorry, everybody. People are joining faster than. Right, let me try sharing again. So for some reason, I can't get this. Okay, I'm not going to share my screen. I'm just going to open up the PowerPoint presentation from a different way. Sorry about that, everybody. Right, let me try again. Share screen. Okay, does it still have that got it thing in front of it for everybody? Is it working now?
My screen looks fine. I could just see a little bar up the top that just says that it's being recorded.
Okay, Dr. Nichols, on your screen, can you use the cursor to unmute yourself? So move the mouse, and down the bottom there should be a thing that looks like an old-fashioned microphone with a red line through it. Just click on that. Hang on, I'll come in and help you.
Okay, there we go. Can you hear me now?
Oh, got it. All right, thank you. Lovely. Okay, so is the screen now good for everybody?
I hope they can't hear us.
All right. Without further ado, I will hand over to the very amazing Dr. Paul Nichols for your seminar.
Thank you, Michelle, and thank you to everybody for joining in. Now, while today is certainly I'm going to talk to you about dental injury, but I'm speaking on behalf of all expert witnesses and report writers on how you can help us to prepare a really good report, because you've given us a really good LOI with all the information we need. So I'm Paul Nichols. I've been a dentist for 48 years, been doing medico-legal work for 30 years, fellow of the Royal College of Dentists and fellow of the Australian College of Legal Medicine. All right, next slide. So today, Those are the 5 key issues I want you to take away. First one is timeliness. We all have a duty to the claimants and to the insurers and lawyers to get our job done quickly. Because if you're a bit slack and it doesn't get done, then the injuries can get worse. So you need to get the documents out to us as quickly as you can. Make the appointment for the claimant as quickly as you can, so that we can save further injury. So the key is the quality of the letter of instruction, your LOI, and the key is the pre-accident record. Unless we've got those, we cannot give you a definitive answer to causation. We have to know what was there before the accident. If we don't, it's just speculation. So please, the take-home message is make sure that the expert has all the pre-incident clinical record and x-rays. Now, x-rays are a problem because they don't photocopy well. You need to, mostly they're digital these days anyway, so they have to be emailed to the expert and they have to be labelled and dated. If they're not labelled and dated, they can't be used in court. So also at time of incident record, the time of injury, you need to get the clinical notes and x-rays of the person who first examined them. Because by the time they get to us, sometimes half the treatment's been done and we don't know what the injury was. X-rays, again, emphasised, must have those pre-accident, at time of, and subsequent, if there are subsequent. Next slide, thank you. Just one example, see that dark tooth there, that was fractured in a car accident, and due to delays on the part of the insurer, the claimant didn't receive timely treatment. If he had, all he needed was a filling. But the tooth died, that's why it went black, and he got infected, so he couldn't have a root canal therapy. The tooth had to be removed and replaced by an implant. Now, you've all heard about implants, they're very expensive, $7,000 as a minimum. And the insurer in this case was deemed liable. Thanks. Now, with your LOIs, check your form letter. Most of you use form letters as I use templates. But it changed more than just the name and the date. Change the medical to dental or to plastic or whatever. And with the font, anything less than 13, I believe does not copy or fax well. Delete the irrelevant questions from the template. You need for home care, for instance, in the dental case. Don't duplicate, repeat questions. Try and keep it simple and straightforward. And give the experts some background. You should all meet and talk to the claimant, ask them what happened, and give me a little story as to what happened, so that I'm in the right frame of mind when I start to read the document. Summarise the incident, injuries, and the claims. So I want your story and your impression. Always have your phone number and email below your signature so that we can ring you and contact you if we need to ask any questions. Thanks. Now, documents sent via links are a problem. There's always too many. I mean, I had one yesterday, had 700 pages. We just can't, and they all wouldn't download. You just can't do that. You have to extract the documents that concern the expert. So in my case, you have to go through it, extract the dental documents, the dental records, the dental x-rays, the clinical notes, and the dentist report. I don't want psychiatric reports. They're too big, and we don't need them. So we don't need the medical specialist reports. We need those that refer to us, to the particular type of specialty we are. Thanks. So help establish the pre-existing condition and therefore causation. So we need to have those pre-accident records. I'm going to say that about 20 times today. Pre-accident records, because they're very rarely sent to us. Inform all the claimants they will need to provide their pre-accident records and x-ray. Unfortunately, these days you normally need to have a letter of approval from the claimant to the dentist before he will release records and x-rays. Most dentists are very cooperative. If you ring them up, they'll send the records and x-rays direct to me. The claimant may need a letter of release. Ideally, we need 5 years and 1 year. For instance, if we can go back 5 years, that's good because then we can know what it was like and what's happened in the 5 years prior to the accident. Notes are often cryptic and illegible, particularly if they're handwritten. And if you get handwritten notes, you just have to ask the dentist who provided them to do a typed transcript, because they're going to be used in a legal environment. They need to be typed. If you can't read them, then neither can I. So if you can't read them, you have to contact the dentist who provided that particular clinical notes and ask him to type it. The type transcripts need to identify the claimant. Quite often, there's no names of them. There's no name of the dentist on the clinical notes. So when you request the clinical notes, so please put the name of the claimant and the dentist, and they have to be signed to be a legal document. Thanks. So here's an example just to amuse you. Obviously here there's a patient has very poor oral hygiene. Pre-accident condition of decay in most teeth. The pre-incident record showed there was a filling with a recurrent decay, and the claimant failed to return for restoration. They had a car accident, and they're now claiming that that tooth was fractured because of the accident. Well, tooth due to decay was the major causative factor. And the pre-incident condition proved that. The x-rays that I got from before the accident showed everything. That the tooth was highly compromised with a huge filling in it and with recurrent decay well before the accident. At best, the pre-incident condition was aggravated by the incident, and the insurer has diminished liability. And it's all to do with contributing negligence on behalf of the claimant and failure of duty of care to themselves. They all have it. And we always talk about failure of duty of care of the doctors. The patients have a duty of care to themselves to look after themselves to a certain extent. Thanks. Next. Right, now here's the case that you should be able to work out. See that broken tooth? It's set back from the other teeth. So how on earth would anything get in there and break it in a situation of trauma? And the pre-incident record shows that that tooth had been removed many years ago, and it fell to pieces because it got decay underneath the crown that was there. So that case was definitely liability denied and provable. Thanks. Always useful, mostly essential to clarify the pre-incident conditions, diagnose the injury and clarify causation. Advise the claimant, you must advise the claimant they must obtain all their x-rays and help them with a letter of release. So either the pre-incident records are sent directly to the expert, or if you can't get that, then the claimant must be advised that they have a duty to go and get them themselves. Remember that x-rays do not photocopy. Instruct the claimant to obtain and bring the original with them if they are analog, and have the digital x-rays emailed direct to the expert or direct to you, and then you pass them on to us. No x-rays is the most common reason for a review, a reassessment, and supplementary report. I'd say at least half of my reports are predicated on access to x-rays. I just cannot do a diagnosis, or I cannot make a comment on causation until I get the pre-accident x-ray. And more often than not, they're not presented with the LOI. Thanks. Oh, with the x-rays, there may very well not be pre-accident x-rays. A lot of the claimants have never been to a dentist. You have to find that out. You have to declare that. And if you declare that, then I am entitled to make a considered diagnosis and considered opinion. But if there are x-rays available, I can't do that until I see them. Now, here's an original x-ray showing tooth 1 with a pin. retained composite filling that is fractured and with recurrent decay. You can see where the black stuff is, that decay. The pre-incident records show that the claimant was advised 5 years before the accident that the filling was temporary and he needed a crown urgently. He also needed to improve his oral hygiene. He did not return to the dentist. Causation was reported only 20% of the incident. Sure, the incident may have aggravated the failing tooth, but it was a failing restoration that was the major cause. Thanks. Now here's an X-ray, the same X-ray that's been photocopied, and as you can see, it's useless. Now, when you go through your documents and preparing them for an LOI, if you can't see a tooth in the X-ray, then neither can I. And you have to ask the dentist for the originals or to email the digital direct to the expert or to you. Thank you. Now, here is a good X-ray. Right? It's a digital that's been forwarded, but there's no name and there's no date. And it just, I mean, I can certainly determine things from it, but it can't be used as evidence in a court unless it's properly labelled and properly dated. Because it could be anybody. I mean, there could be collusion going on. So it must be properly labelled. Thanks. Right, when you're doing your LOI, don't just say medical assessment, say what it is, because the claimant has to know what documents they need to bring, because they have multiple injuries most of the time. You need to say they're seeing an orthopaedic surgeon, a psychiatrist, or a plastic surgeon, or a dentist. So that they have to be said, you're going to a dental assessment, not a medical assessment. And always instruct them to please take their dental x-rays. And the best procedure to ask the claimant for the name of the pre-incident treating dentist, call the dentist, request regional x-rays posted directly to you, ask if they need a letter of release, and have the claimant sign, then fax to the dentist. And that way, do that well in advance, and that way everything's ready to go. Thank you. Another example, just for fun. You may not be able to see, but there is a vertical stain, that's it, crack in that tooth. Now, a vertical crack, a stain tooth crack like that is usually pre-incident from bruxing. You all know about bruxing, grinding your teeth at night. See how that tooth has a very flat incisal edge. That patient's been grinding their teeth for ages, and the crack is due to bruxing, not the accident. And I was able to say the causation was a pre-existing bruxing. Thanks. On the other hand, a horizontal fracture that has no stain, you can hardly see it there, is a younger tooth is most likely caused by the accident. That's from trauma and not bruxing. So that was a genuine claim. Thanks. Now this one here is interesting. You can see it looks like a fracture, but it's not. The pre-accident records and X-ray show that patient had really heavy bruxing and had worn her teeth right down almost to the gum, and the dentist had built them up in plastic and had told her that it was just a temporary measure and that she would need to have her teeth built up in porcelain. Well, of course, she had an accident and the tooth broke, and who knows whether the accident aggravated or not. But that is not a fractured tooth, as she claimed. That is a fractured temporary filling, and the claim was denied. Thank you. Now, on the left is you can see those chip teeth there, a young, pristine teeth. And during the accident, the patient had whiplash, and in whiplash, common to have violent occlusion. Violent occlusion is the rapid coming together of the dental arches and causing trauma. So the case on the left is genuine, violent occlusion. But the case on the right is a huge filling whereby most of the tooth was drilled away and a plastic filling was put in, which will last 5 minutes. But still they made a claim that it had broken the accident. Well, I was able to show from the pre-accident records. The tooth has been heavily filled for 15 years. But the patient was recommended to go back and have a crown, and she didn't. So she lost her case. Thank you. Trauma and loss of teeth. You can see on the left, that's obviously an old patient with teeth that have been moving around and all worn away. And there's a tooth missing, which, as the patient claimed, was knocked out by the accident. But the pre-accident records showed that that tooth had been missing for 5 years. On the right, the younger patient with teeth that are missing. And just from even looking at it, you can tell that those young teeth were knocked out by trauma. So I was able to confidently declare that the causation of the missing teeth was the accident, together with other evidence. Thanks. Now, multiple loss of young dentition, usually trauma 100%, but you still need the pre-incident records just to confirm that those teeth were in fact there before the accident. In this case, it looks as though they might have been all knocked out by the accident, but they weren't. If you look carefully at the gums in the front, you can see that they're stained. They've got some dark hue behind them. Well, those teeth were missing because they were removed due to infection and loss of vitality a good 5 years before the accident, and this patient actually had a denture. So while there was the tooth on the right side of the slide where the gums looked normal, they were knocked out because the blow was on the left-hand side of the face, but the other teeth were not, the denture. So the patient was able to claim for one tooth rather than the 6 that she tried for. Thank you. Here we have a loss of a tooth and a fractured tooth and a stained tooth on the right side of the slide. Now, it's a tricky one because it looks as though it's been trauma, but the pre-accident X-rays and record show that there's an existing condition before the accident, that the tooth in the middle was missing. Sure, what it might have been knocked out, it had a pre-existing condition of fragility because it had a root canal therapy and a huge filling. So I was able to say, well, the causation is complex, and that I estimated that the fair allocation would be 50% to the accident and 50% to the insured. Thanks. Lost tooth and discoloured tooth, you must get the pre-accident records in this case. The discoloured tooth had a pre-incident root filling and therefore was unrelated to the incident. But the tooth that was missing was in fact knocked out by the accident and it was claimed. Thank you. Now this claimant had been to the dentist after the accident, and the dentist said, yes, you've fractured your tooth and it's sensitive and you need to have a filling. Because the sensitivity abated, the claimant didn't go back to the dentist. 5 years later, the tooth dies and the other tooth becomes very sensitive and there's a claim. But the claimant failed in their case because they failed in their duty to mitigate against further damage by seeking appropriate treatment. If the patient had so returned to the dentist, the insurer would have been liable for $500 billing, but the patient, when they finally went back, they needed a $3,000 RCT in post-court. So the insurer's liability was limited to the $500, because you all know that as far as liability is concerned, the liability of the insurer is limited to that treatment required to return the patient to pre-accident condition. Well, in this case, it was there was a normal tooth there, but they just needed a filling to return to pre-incident condition. But in the end, it had to be an RCT, and the insurer wasn't liable. Thank you. So the message is timeliness, a duty of care, quality of your letter of instruction. Pre-incident records, I'll say it again, pre-incident records are the key. At time of incident records as well, and x-rays especially. X-rays have to be original or digital, and always obtain an opinion before approving any treatment. Because while it might seem very obvious that a tooth was damaged because of an accident, it may not have been. Now, is there another slide? Next. Oh, this is just the tooth identification chart. Next. Next. Now, recent trends. Medications for pain and depression after an accident can cause xerostomia, which is a dry mouth, which can cause decay. Now, a lot of lawyers are aware of this, and they're claiming that the patient has a mouthful of decay because of the medications they had to take due to the accident. Now, this is a tricky one because the duty of care here lays with the doctor who's prescribing the medications. Doctors have been emphasised lately that they must, when they're prescribing medications, they must advise the claimant as to the risk involved, not just xerostomia, but all the side effects that their medications might have, and they very rarely do it. So a claim is made, and I'm able to say, well, the problem here is that if the doctor who started prescribing these medications 3 years ago had warned the patient could have gone to their dentist and entirely prevented the enormous amount of decay that they now have. The other one is temporomandibular joint dysfunction after a whiplash injury. Now, these are a bit tricky too, because they really should be referred to a specialist prosthodontist. But what happens here is 95% of them get better by themselves with instruction. If the claimant complies with instruction, this means rest the joint. And just like if you've got a dislocated knee, you have to rest and have a splint. And a temporomandibular joint is difficult because you can't have a splint because you have to talk and eat. But if you're careful, in time, the TMJ will heal up. So, prescribing doctors have a duty of care to warn of the residual effect and advise they see a dentist. And the insurer then has diminished liability. All the conditions caused by medication can be totally preventable with good oral hygiene and fluoride mouthwashing. Simple as that. And it's such a tragedy to see these claimants with a mouthful of decay and periodontal disease would have been so easily prevented. Warning, next slide may cause distress. See, it's a pretty ugly sight. Believe it or not, there was a claim made that this was caused by a car accident. This is, keep this in the back of your mind. When you see this, it's drug addiction. This is caused by addiction to heroin. When people are addicted to heroin, they tend to have very poor oral hygiene. They get xerostomia and they get rapid decay. So that's a little trick for the unwary. Is there another slide? This is they're saying they need to see a specialist prosthodontist who makes them a splint. It's like a mouth guard they wear at night. Because the problem with TMJ dysfunction is everybody bruxes, everybody grinds their teeth at night. If you've had a temporomandibular joint trauma, then the bruxing may aggravate that, and you need to have a specialist prosthodontist make them an occlusal splint, like a mouth guard, that they wear at night. It just protects the jaw from damage from bruxing, and it'll get better. Now, some claimants claim they get lockjaw from whiplash, and it does happen in about 3% of cases. Again, you need to refer them to the prosthodontist. Well, I do that for you. I recommend in my report they see a prosthodontist who proves or otherwise that they have lockjaw. Thanks. Next slide. WPI. In the case of dentistry, it's very difficult to get 10% that you require to be successful for a claim, because the injuries are assessed after treatment. Very, very few oral conditions can't be returned to what they were before the accident, and have a greater than 10% WPI. They have to prove that they can't eat virtually. They need a restriction to soft foods only. And it's interesting that pain is not considered, and it saddens me a bit, because a lot of patients still have pain even after treatment. And while they can eat, it's very painful for them, and they don't get any consideration at all. In my view, they should. And if you can't enjoy a meal without pain, I think you should be compensated. But the regulations say that pain is not to be considered when you're assessing for whole person impairment. And this is an old slide now. It's after 19 years as an assessor for the motor accident, and now the PIC and work cover. Of about 200 cases, only about 6 were assessed at more than 10% WPI. Thanks.
Thank you so much, Dr. Nichols. That was fascinating.
And
And thank you for warning us about that slide before it came on, because that was pretty gruesome. If anyone was thinking about...
I do have some more comments before they ask questions.
Oh, cool. Go ahead.
There's some very recent trends. You're all aware of PTSD. Now, patients who have PTSD quite often go on antidepressants and pain medication, and they get xerostomia. And all the lawyers now are claiming that the PTSD was caused by the accident, and the accident caused them to take medications, and they're now claiming for a mouthful of fillings to be done, or whatever they need. I'm now saying that unless that they can prove that the doctor did not advise them that there were restrictions, dangers of side effects, and they don't get compensated. And it all then falls on the doctor. I'm hoping that the insurance companies are allocating causation to the doctors who have failed in their duty of care to inform and warn. The other one is, can't remember now. Anyway, I think that's probably enough. Are there any questions?
Thank you, everyone. If you would like to ask a question, you can unmute yourself and speak up. I just want to interject, somebody has written a question in the chat, and that is, does this session count towards CPD points, or depending on what state or territory you're in, CLE? Yes, it does. All you need to do is provide evidence of your registration and attendance of the seminar to your local law society in your state or territory. And in our experience, they will always award a point for this. I have a question from somebody who wasn't able to attend. If you don't mind, I'll kick off, and then if people get more confident, they can ask. The question that I have is the notice of an increase in paediatric poor oral hygiene and children having really bad dental outcomes. And the question is talking about the prevalence of foods that children don't have to chew, like those sippy yogurt pouches and lollies and things like that, and children being put to bed with a bottle of juice or milk and then getting dental caries in their baby teeth. Is that something that you're noticing as an increase in presentation?
Oh, certainly, amongst the profession as a whole, but it's not really related to motor accidents and work cover. But yes, about 20 years ago, when I was still in private practice, the children started coming in with a mouthful of decay, and we were at a loss as to work out why. Because they're all from, well-to-do families who they should be aware of oral hygiene. What it was is they were taking bottled water to school, and they weren't drinking the water out of the tap, so they weren't getting fluoride. Well, the way to correct that, of course, was to buy the bottle of water, tip it out, and fill it up from the tap and give it to the child to take to school. But the other thing is the lack of discipline. The children are given lollies and they aren't educated properly. I don't think they get much oral education in the schools these days. They're too busy with the LGBT stuff. And so it's a combination of education, don't eat lollies, which you do, clean your teeth, and have fluoridated water in your take to school. Simple.
Rightio. And one of the other questions I have, and it relates to, it's come from a workers' compensation insurer's case manager, and they're saying that a denture or a piece of bridge work, how long is that expected to last before a person would have to have that replaced?
Interesting question. In the case of a denture, probably between 5 and 10 years. It all depends what they're doing. If they're grinding their teeth heavily and have a poor old hygiene, probably every 5 years. With a fixed bridge, that should last 15 years, but we quite often see them fail because of poor old hygiene after 10. The new implants are interesting. Theoretically, if they looked after, good old hygiene education, what have you, and regular preventative care once a year, that should last a lifetime.
Wow.
The ones that fail from a peri-implantitis is called, it's because they haven't been cleaned properly. An implant can still get periodontal disease. It can't get decayed, but there can be terrible gum problem.
Right. Bree, do you have a question?
I do. One of the points that you're very, very clear on is pre-incident records. It's not common to have pre-incident records for, say, pre-employment checks involving dental. Is that something that you would encourage from an employer's perspective?
Oh yes, I'd always encourage that, but I'm not too sure how that's going to help the employer. The employer should be interested in the current dental record to see if there's any contemporaneous problem looming. Because if they're going to go out to an oil rig or somewhere to work, you want to have a very high standard of oral hygiene. Because if their wisdom tooth plays up or their root fill tooth plays up, then they're going to have enormous problems. Have to fly the helicopter out and bring them back, I suppose.
Yeah.
So contemporaneous records would be more relevant to an employer.
It's a tricky one to try and establish a baseline when an employee starts with an employer on what pre-existing dental or even like physical injuries occur. So I'm just sort of exploring that.
Again, yes, you put their contemporaneous X-rays in their file. Well, this is what they were like when they started working for us. And
Okay.
they have it. Yes.
Doctor, we have another question for you, and it says, how could I deal with a claim where it is impossible to assess the client's prior dental records from Fiji because the dentist there has long gone out of practice? The client was assaulted at work and lost her tooth. Unfortunately, she is suffering from a severe tooth decay, which makes it difficult to assess the strength of the claim.
Yes, and this is quite common. When I emphasise pre-accident record, I mean you have to prove that you made an effort. Either the assessor, the claim manager, or insurance company, or the lawyer has made an effort to get the record. Quite often they've never been to a dentist, so there aren't any anyway. But in that case, where they've made a provable effort to get them and can't, then I'm entitled to make assumptions and to make a considered judgment.
Fair enough. Another question we... Oh, sorry, sir.
Because my opinion cannot be tested.
Yeah, fair enough. Now, this person says, I've seen an uptake of claimants who travel overseas for treatment. Surprisingly, a recent trend of orthopedic patients travelling to India for surgery. Out of interest, what is your experience and opinion, obviously within your specialty of dentistry, of treatment and work performed overseas?
Good question. It all depends where they've been trained. Some of them have been trained in the best dental schools in England, for instance, and there's no problem. But the average dentist in Asia, the standard dentistry is not that good. When there's a problem, of course, the onus is on the dentist who provided the treatment. Quite often we can't fix it here anyway because they've used the main problem is implants. The people go overseas because implants are so expensive here because we use very high quality implants from Sweden, whereas the local ones made from tin over in Asia don't last very long. And then the patients come in, and when they come back to Australia, they come in and see us and say, "Well, can you fix it?" They say, "No, sorry, we can't get the appliances to replace what the damage. You have to go back to your dentist in Asia and have them fix it." And in case of motor accidents and work cover, I mean, they'd be very silly to do that, to go overseas, because an insurer will have no liability.
Yeah. Look, thank you so much for that. That was absolutely informative and interesting. And I think there's a lot to take away in there for claims managers, case managers, and lawyers in what you need to have in the back of your mind to ensure that your letter of instruction is going to get you the best report that you can. Thinking across, outside the box, as they say, of all the things that you can provide to ensure that the report you get is what you want, that the detail and the information you get is accurate and based on evidence, and that your claimant gets the fairest assessment by the specialist because the specialist is armed with all the information. So look, thank you all so very much. The recording for this session will be sent to you sometime, hopefully later today, but it might be tomorrow morning. And you can always watch our seminars on our YouTube channel. Those of you with the Mag Connect login can access that through the dashboard on the seminars tab. We will keep letting you know about our seminars. And thank you so much, Dr. Nichols, for your time and your wonderful advice today. Have a great rest of the day, everybody.
I look forward to some really good LOIs.
Thank you.
you.
Bye.
Bye.
Bye.